Dear students, today we'll be learning about brachial plexus. Brachial plexus is one of the very important topic when we'll be talking about upper limb, and if we have doubts about the understanding of different concepts of brachial plexus, then we will be struggling always. So we need to have a very good knowledge, and this topic is of high importance, and you are highly recommended to stay connected with this topic. So now I'll go over what do you see in this image. These fingers are not really normal. What happened? That we'll be looking forward. These are my objectives for my today's presentation. We'll be discussing location, boundaries, and content of axilla. Then we'll be talking about formation of brachial plexus. And then to understand the brachial plexus and its formation, I'll be explaining a little bit and reviewing spinal nerve and how a plexus is necessary and why it is needed. And then the second part of this presentation, which I'll not be discussing today, I'll be going over some injuries which are encountered for my brachial plexus. Now you're looking at in this image. We have seen these things during our previous session, and I'm sure when you are visiting your labs, you must have seen all these. This is a human body, this is a cadaver. This is the anterior aspect, and here you are looking at anterior chest wall, and this muscle is nothing but pectoralis major. This is posteriorly, we are looking at latissimus dorsi, and then this, which is located on the lateral wall, you can see this muscle arise in serrations. This is my serratus anterior. Look at it, the same image. You're looking from lateral view, now you're looking from front, and there you can see this beautifully dissected is my pectoralis major, and look at this vascular pattern. There you're looking at latissimus dorsi, there is my serratus anterior, and there, we have removed all of the things, but now everything is being cleared up, it's been lifted. So you can see this bunch of different tubings. These are not tubings, this is the neurovascular bundle, and what is very obvious here is the nerves. What are these nerves? This bunch of nerves is called brachial plexus. Look at in these two pictures, there you can see a human, and there you can see when he has abducted his arm at his shoulder joint, you can see there is a space created. And if you remove the skin and look at this sketch, there you can see the same muscle which we talked about shortly. We talked about pectoralis major. This is my latissimus dorsi, serratus anterior. So many things are visible, but we are not going in their details. We'll be looking forward. Now, on a skeleton, can you see this is where my scapula, clavicle, my first rib, and in between there's a space. This space, how I understand that, let's look at it. This is the same thing. So this pyramid shaped thing is wedged in this space. So this is the bony skeleton. Let's look at it more clearly. It has a broad space and it is very truncated at the top. This top is the apex, this is the base, and then this, as I said, it's like a pyramid, and it is located in my lateral thoracic wall, very close to my upper ribs, and laterally I have upper humerus. And this truncated thing is going under my clavicle. You can see the first rib is also being shown, and this is what axilla. Now look at a human, what we are talking. Can you see a fold? We call it anterior axillary fold, and you can see posterior axillary fold. We have seen this, we talked about that. And now within this space, can you see this green thing? So this is the same what I was trying to show you with those schematic pictures. That's my axilla. More closer views we have talked about. And here what you can see within this axilla, you can see the neurovascular bundle. What is neurovascular bundle? You can see the nerves, you can see the artery and vein. Now this is a section. Guys, this is a transverse section. This is a real human image. And this, if we can pay attention, you can see the deltoid muscle, you can see the humerus, and there you can see medially, this is my thoracic cavity. Look at its serratus anterior, how beautifully it's been located. And this one in front and at the back. So you are looking at pectoralis major, minor, and then you are looking at the serratus anterior. And let's label it. Let's go in details. So as I said, this is the anterior aspect, and this is my pectoralis major. This is my pectoralis minor. And at the back, there you can see the scapula, and there you can see this my subscapularis, and on the other side you have supra and infraspinatus muscles, which has been partially shown. Now same concept. Now it's my favorite diagram. Let's look in here. So axilla is a space between the arm and the upper part of my thorax. And it's a gateway, it's a pathway who connects my upper limb with the thorax and the neck. And the major structures, they traverse through it, back and forth. And it shapes like a pyramid. And as we have said already, flat top, and that has a name, cervico-axillary canal. The word cervico goes for neck, axillary for axilla. So this is a canal. And we had communication through this cervico-axillary canal. We have connection with the neck and the thorax. Let's look at it. So right now, this yellow structure is the base. Where is the base? Your armpit. When you abduct your arm, so this is the floor, and who contributes in making this? Axillary fascia. You cannot see it, but you can see your skin of the armpit. And then can you see this on top? This narrow down structure, that's the apex. And what is that? That is given a name, cervico-axillary canal. Now this is a medial part of my axilla, and that is close to my rib cage, upper ribs. And that is the medial wall. Who makes it? Upper ribs and serratus anterior, which is attached in this location. And now this blue thing is the lateral wall. And who's there? Primarily upper humerus. And what is attached to that? And then posterior wall, who is contributing there? We all know there is scapula, and in the anterior part of the scapula, on its costal surface, we had a muscle which is named as subscapularis. And then what's that? That's my anterior wall. And we all agreed upon, there we have pectoralis major and minor muscle. These are the main contributors. There are small things, but I'll be discussing here main and major things. I'm not going in minor details. Now, this arrow is showing me a pathway. Where it is leading me to? It's taking me to the neck. And this one is going towards the superior thoracic aperture. This arrow takes me inside through the superior thoracic aperture into the thoracic cavity. And then the base is directing me where? Towards my upper limb. And now let's cut this box, section it, and see what is inside. And now from this A to A, when we cut it, this is what appears to us. Let's label it. Sternum, which lives anteriorly. Humerus, we all know about it. Scapula. And then these are the ribs. As is a section, so it can show you one rib, but definitely what you can see from this picture, 1, 2, and 3 ribs, they are all there. And this is a famous place. We learned it before also. This is my intertubercular groove or bicipital groove. And now, same image. Let's bring this muscle, a huge muscle, from the costal surfaces and from my sternum towards the lateral lip of the humerus. Who's that? We all know, pectoralis major. And this is my pectoralis minor. What are they doing? They are making anterior wall. Medially, what do we have? Serratus anterior and the ribs. Which ribs? Upper ribs. Posteriorly, you can see scapula. Now it's been covering what subscapularis muscle. There, another muscle which is going to my medial lip of my bicipital groove, that is nothing but my teres major. Excellent. And now look at it, someone is going in the floor, and we all know this is my latissimus dorsi. Laterally, what do we have? Biceps brachii muscle. How much? Which part of it? It's tendon. One which is going through this groove, that is the long head of the biceps. But we also have next to it the short head of the biceps. So they are being located laterally. Lateral wall, they are visible. And then someone else is there, and that is my coracobrachialis muscle. This muscle we'll be learning in detail when we'll be talking about arm. Okay, now what are the structures who are present within my axilla? Can you see this red circle? This is an artery. It is in the axilla, so we call it axillary artery. A vein next to it, look at it, how it's textured. This is my axillary vein. And then we had brachial plexus. Which part of the brachial plexus? Can you see these nerves? One is located lateral to it, so we call it lateral cord. The cords of the brachial plexus are located here. And we name them on the basis of their relationship with the axillary artery. So you're looking at the lateral cord. Now what are you looking at? Medially located, medial cord, and posteriorly located, posterior cord. Are we good so far? So these are the three main neurovascular structures which are primarily found within the axilla. They are enclosed in a sleeve, in a sheath. And this sheath is located in my axilla, so we call it axillary sheath. And then this whole space needs to be packed. So, but before going to that, we can see that from the lateral cord and medial cord, we have the branches, and which are going to supply my pectoralis major and minor. So they must be lateral and medial pectoral nerves. Are we good so far? Now, this whole space is filled with the fat. So this fat is in the axilla. So what we call it? We call it axillary fat. And then, can you see these bean-shaped brownish structures? These are nothing but axillary lymph nodes. Knowing about lymph nodes is really, really important. They are helpful. They are the guides when we are staging someone. If someone is diagnosed with a cancer, then the next thing which comes in the mind, which has to be done, is the staging, that what is the grade, what is the extent, and how we can plan a treatment for this type of cancer. So we need to have a nice information, and information can be revealed by looking into these lymph nodes, and that will tell us that is this disease is organ confined or it has metastasized. Metastasized means it has spreaded into the neighborhood. And then we can say this is a grade 1, grade 2, grade 3, vice versa. Are we good? Okay, now before starting the brachial plexus, we need to have a quick recap. You have taken 2 sessions for the spinal nerve. So during this quick recap, we can see how a spinal nerve is formed. Before going there, you should be well aware of that, the spinal cord, and you can see there are different colors shown to you. So now this upper segment are my cervical vertebrae, and they are 7 in number, and then this greenish thing is my thoracic vertebrae, they are 12, and then at the bottom lumbar, 5 lumbar vertebrae contributes here, and then the sacrum they are 5 vertebrae, they fuse together, and then at the bottom there are 3 to 4, and they are making my coccyx. So this is the full detailing of my vertebral column. We'll be learning about this topic next year inshallah, but right now just to have a quick idea. Now look at the spinal nerves and look at it how these spinal nerves contribute in making these different plexuses. These plexuses are really important and we need to understand. And look at each segment, we have the individual, you can see these colored things, they are corresponding to my previous picture. So these are the cervical, thoracic, lumbar, sacral, and coccygeals. We talk about 7 thoracic vertebrae, but right now I'm showing 7 cervical vertebrae, but right now I'm showing you 8 spinal nerves that we need to understand. Now, let's come to a transverse section. This is somewhere in the thoracic region. Let's label it fast. Now, this is my white matter, and look at it, the gray matter. The H-shaped thing is the gray matter. And look at it, it has horns. The ventral or the anterior horn, primarily its an activity is a location where we have the motor neuron cell bodies. So the ventral horn lodges what? Motor neuron cell body, and from where you can see the motor fibers is coming out to be going towards to make my spinal nerve. And then the channel which it takes, the route what it takes, it's located anteriorly or ventrally, so we call it ventral route or anterior route. Now look at it, my dorsal or the posterior route, it's not like this, it is little bit balloon up, it is swollen. Why it is swollen? This swollen thing, this swollen appearance, we call it dorsal root ganglion. And why is being swollen? Someone lives there inside. Who's that? That is my sensory neuron cell body that lives there. And you can see backward it's connected to my spinal cord, it relays there, and then through the tracts it reaches to my cerebral cortex. And you can see now the sensory fibers has been shown going towards in contributing to my spinal nerve. The sensory fibers are bringing sensory inputs. What are the sensory inputs? Pain, touch, thermal things, proprioception, all these sensations are the sensations which has been brought from the receptors, and they are traversing towards the higher center through the spinal nerve and then through the spinal tracts and going to the higher centers. And if any incidents, any kind of information has reached to my higher centers, immediately a decision has been taken and the motor fibers has been directed to interact, and with their action the nerves, they are activated, they create movements at different joints, and we perform different actions. Are we good so far? Now look at it. What are we making now? Now through the intervertebral foramen, a spinal nerve is emerging out. And this spinal nerve, still it's not complete because something is missing. Who's that missing? Within my thoracic segment from T1 to L2, we have this green thing, and this elevation within my spinal cord, we call it, this was my ventral horn, dorsal horn, and this one is my lateral horn. And in this lateral horn, we have someone who's living here like my motor neuron cell body and the sensory neuron cell body. There is another cell body, but that is green in color. So that is sympathetic neuron. And this is from T1 to L2. That's the only location where we can find this. Above and below, it's not there. And we will be more learning about this concept in the upcoming sessions, not today. And from here we derive this preganglionic sympathetic fibers. They relay into a ganglion which is connected before the formation of my spinal nerve. And this is very important. These preganglionic fibers, they relay inside, and then these are my postganglionic fiber. And what is that location called? This is called sympathetic trunk ganglion, and they contribute in making a sympathetic chain. And now look at it, my spinal nerve has all three elements, and each spinal nerve of my body, all except for one, all of them have motor, sensory, and sympathetic. Why we need motor? For the skeletal muscle. Why we need sensory? For all the sensory inputs. And why we need sympathetic? Because we all know we have smooth muscles. They are widely scattered within the wall of my blood vessels and other glands which are located in my skin, the sweat glands, and a lot is there, and they all need to be controlled. And who's controlling them is my sympathetic, and that's not in our control. It's an autonomic system, part of an autonomic system. So now together they are giving me motor, sensory, and sympathetic. I hope we are good with this. Now, what is a plexus? At certain body places, you need to understand this concept when you'll be learning more details of the limb development and all that. So the different spinal nerves, they join to form a mesh, and this mesh is responsible for making plexus. Let's make an how a plexus is made. So what I have done, I have taken two spinal nerves at different levels. What are these levels I have taken? I have taken C5 and C6. Similar what we were talking before, and from there I derived two spinal nerves. We are good so far. Are we good? Now you can see that each spinal nerve, when it comes out of intervertebral foramina as a spinal nerve, it bifurcates into someone is going in front and someone is going to the back. The one who's going to the back, we call it dorsal ramus, and one which is coming to the front, we call it ventral ramus. Remember, this is a key point. Any plexus is formed from the contribution of ventral rami only. Dorsal rami doesn't contribute in making any of the plexus. And what is the job of them? They have all the characters of a spinal nerve, but they are responsible to control what is located within our back. But these ventral rami, they make, if there's a need, not all the spinal nerves, but at certain places, like if we look into the spinal cord, at the upper level there's a swelling, and at the bottom there's a swelling. The upper one gives us cervical and the brachial plexus, and the down one gives us lumbar and the sacral plexuses. Today we'll be learning about brachial plexus only. So now you can see that this ventral ramus, look, ventral ramus of a nerve above like C5 and ventral ramus of C6, they are blending with each other. They are joining with each other, and their union, that gives me a nerve trunk. Now we don't use the term spinal nerve here because two spinal nerves, their ventral rami, they join to give us a nerve trunk. And this nerve trunk further it divides into anterior and posterior. Let's give it a color, so that will be helpful for our better understanding. So I'll be using yellow color for my anterior division, so let's make it yellow. And my posterior divisions, we will call it posterior division. Guys, I am using some names here. Remember, these names are different for each plexuses. So here I am showing you what within my this brachial plexus, the anterior division is responsible to give me these very major important nerves, and the posterior division is giving me these two names, the axillary and radial, and the anterior division gives me musculocutaneous, median, and ulnar nerve, along with other things. Are we good so far? Now, let's look at, there you are looking at a real brachial plexus. It's within a human cadaver. After dissection, everything has been cleared up, axilla has been cleaned down, no vein and lymphatics and fat, everything is taken out. Only you can see this tube-like thing? And this tube-like thing, it's been cut in between, so that everything should be very nicely visible to you. And this cut tube-like structure is my axillary artery. Vein has been sacrificed here, and you are looking purely the different components of my brachial plexus. And when we study all these kind of things, we use CT scans and other diagnostic tools. They will help us to understand so many things when we are evaluating someone for some kind of problems. Now, this is the same thing, and there you can see the axillary artery, and then it's running, and here we don't call it axillary, we call it subclavian. When it enters my axilla, we call it axillary, and when it leaves it, we call it brachial, because it's going to the brachium or my arm. And look at it, how these nerves are going across. You remember in the beginning we talk about the lateral cord, medial cord, and posterior cord. Okay guys, so now this table is a key table, and my advice is you should be practicing it. I'll give you an animated version of this, so that will be helpful, and more you practice, better you'll be. So let's put the things here. I'm labeling it, these columns I have been given names. The roots, trunks, divisions, cords, nerves. What are these? My roots are located, roots of what? My brachial plexus. They are located in the paravertebral region. Para means parallel to my vertebral region. And then and there we all know ventral rami is the only thing which has been used. And who's this? My C5, my fifth spinal nerve. C6, C7, C8, and T1. So these nerves, these 5 nerves, they are the one who are making my brachial plexus. Guys, when you will be reading this subject from your text, you might come across another name, and that is prefix and postfix. That is if there is an additional involvement of a segment above or a segment below, but you need to be focused first for this component. So now what happens? C5 and C6, they become friends. C7, nobody likes him. C8 and T1, they become friends. Once they become friends, what is the outcome? What is this interscleneae? These are the muscles who are located in my neck. And now these muscles, in between these muscles, these trunks, one which is superior, above, in the middle, and the below. So these three trunks are going through in between these muscles. These muscles are scalenii anterior, medius, and posterior. And now these trunks, they divide into anterior division, posterior division. We know what anterior division does and what posterior division does. So now this is the scalenii. Let me take it out. And then before that, we have certain tiny nerves which are given before that, and these nerves are having their names. And what are these names? So you are looking at a nerve, dorsal scapular nerve, where it controls my rhomboids and levator scapulae. And then you are looking at the long thoracic nerve that controls my serratus anterior, and if this nerve is severe, that will cause winging of the scapula. Then now from the trunks, what are we getting? We are getting suprascapular nerve, and they are controlling my supra and infraspinatus muscles. And now my each trunk divides into anterior and posterior, anterior and posterior. Look at it. Anterior of my superior and middle, they join to form a chord. All the posterior, they join to form my posterior chord, and now this inferior one, nobody is sharing with him, is left alone. So what we have, so we don't get any branch from this level. So what happens now? Chords in the axillary region, we have a chord which is lateral to my artery, so we call it lateral chord. Lateral to my axillary, medial to my axillary artery, we call it medial chord, and posterior to my artery, we call it posterior chord. So these chords, you have seen them in the beginning. And now from these chords, from the lateral chord, I have what? Lateral pectoral nerve, who supplies my pec major and minor. And from the medial chord, we have medial pectoral nerve, and that is doing the same for the pec major and pec minor. And then we can see these cutaneous nerves. Guys, these cutaneous nerves, they have utilized the motor segment is not there, only the sensory part. So we call them medial cutaneous nerve for the arm and for the forearm. They are responsible to bring the sensation from this area from under the skin. They are not supplying any muscle. Now from the posterior chord, we are getting these branches. Upper subscapular nerve for subscapularis. This number 2 is my lower subscapular nerve for teres major. And this one, a big one, that is controlling my latissimus dorsi. And then in the brachial region, in the brachium, in the arm, we have these nerves. A musculocutaneous nerve for the flexors of my arm. And then we have this ulnar nerve to the ulnar area. And from the posterior chord, we have radial nerve and axillary nerve. These are really important. So now from the lateral and medial chord, we are getting these contribution, and they are making a very important nerve which controls my forearm flexors, and that is my median nerve. So guys, I'll be stopping here, and that is the first formation of the brachial plexus. And now after that, in the next session, we'll be talking in detail regarding how and where these branches goes and supply. You are highly recommended to practice this, and you are expected to come prepare over the weekend, so then it will be good to continue with that. Thank you very much. There you are looking at the axillary artery, and I hope everything is fine. I hope if there is any question, you are feel free to ask. Thank you, my dear.